Assalamu alaikum. I'm Dr. Mudassir Zaidi. I'm a general practitioner in Adelaide. Ramadan Kareem to all of you. Inshallah, it bring khair wa barakah. What I will talk about today is what skin conditions need to have a medical review. Skin is basically, it's not only our protective layer, it does have some harmless spots or growths which could be there for long, but it could be a part of some systemic conditions, some even skin cancers, or there are some chronic skin conditions which definitely need a bit of medical opinion. So I would say that let's talk about, like I said, about some systemic conditions. So systemic conditions like the skin color, like if it is turning yellow, it could be a part of a jaundice. Some people may get a bit thick, velvety skin around the neck or in the axilla, which could tell about that he's at increased risk of having a diabetes or some metabolic disorders. Sometimes just a bit of like a skin rash on the face, it could be a part of an autoimmune disease. Like autoimmune means that our bodies start fighting against the body cells, like lupus and conditions like that. Sometimes, so there are heaps of number of those conditions are there. The second thing I'm talking about, skin cancers. Although like the people, it is being always considered that the people who are, the skin cancer are more common in those who are white, and it is very less common in, it is not there at all, or those who are people of color. I would say that basically it's a bit of a misconception. Skin cancers, I was going through a study, and like the skin cancers do also occur in those who are people of color, and the skin cancer what they get are mostly in the late stages because they are not being known. They think that they can't have it. Moving on further, like there are skin conditions like eczema or psoriasis. You might have heard of it. So these conditions, like they mostly live for life. They can get exacerbated. They can get mild. So in those conditions, also need to have a better look into, have a chat with the doctor, that what are the protective measures you can use, how to manage it. I would say that if any of the skin lesion which is there, which is changing, which is new, even any skin ulcers or wounds which are not healing in a couple of weeks, anything which you're not sure of or you're concerned, it doesn't take long time. General practitioner is your gateway for that. You can have a chat with them. He can have a quick look. They can have a look through like a dermatoscope. There are some gadgets. They may take small biopsy from that if needed, or they can refer to your appropriate place. But rather keep an eye. I think skin is very important. I will conclude by saying that happy and blessed Ramadan to all of you, and have the best of it with your families. Keep us in your prayers, and just look after your skin. It is one of the largest organ of your body. It definitely needs care. Have a very good time. Jazakallah.